محمد صلی اللہ علیہ وآلہ وسلم والصلاة والسلام علی اہل بیت الطیبین الطاہرین المعصومین المظلومین الذین اذھب اللہ عنہم الرجس وطہرہم تطہیرا۔ ناظرین کرام السلام علیکم ورحمۃ اللہ وبرکاتہ۔ پروگرام محفل ولایت کے ساتھ آپ کی خدمت میں حاضر ہیں، اور انشاءاللہ یہ جو ہماری پروگرام کا جو یہ سیریز ہے ہمارا، اس میں ہمارا فوکس جو ہے وہ یہ پینڈیمک، جو یہ کورونا وائرس پوری دنیا میں پھیلا ہوا ہے اور امریکہ میں یہ شدت پکڑتا جا رہا ہے، اور اس حوالے سے بہت زیادہ ضروری ہے، پہلے بھی پچھلے پروگرامز میں عرض کر چکے ہیں کہ بہت زیادہ ضروری ہے اس میں پبلک اویئرنیس، کہ ہم میکسیمم پبلک اویئرنیس کریٹ کریں انشاءاللہ۔ اور ظاہر ہے کہ بغیر ایکشن کے اویئرنیس جو ہے وہ بیکار ہے۔ ہمارا جو مذہب ہے، ہمارا دین یہی سکھاتا ہے کہ جو بھی ہمارے عقائد ہیں، عقائد کے بعد جو کچھ بھی ہمیں ہماری تعلیمات ہیں اسلام کی، ان کو ہم پریکٹیکلی امپلیمنٹ کریں۔ فقط علم حاصل کرنا کافی نہیں ہوتا، علم کے بعد عمل بے انتہا ضروری ہے۔ ناظرین، بالکل یہی فلسفہ، یہی فلسفی آج کے ہمارا جو یہ ہماری پوری دنیا جس چیلنج کو فیس کر رہی ہے، اور پوری دنیا میں تقریباً یہ وبا جو ہے پھیل چکی ہے، اور امریکہ کی جو میں اسٹیٹسٹکس دیکھ رہی تھی اس میں بتاتی چلوں، یعنی دے آر ویری الارمنگ، پریشان کن ایک صورتحال ہے، ایک سیریس صورتحال ہے، اور ہم سب کے سامنے ہے کہ ظاہر ہے کہ پوری جو ایکٹیویٹیز کو فریز کر دیا گیا ہے، کہ اسکول بند کر دیے گئے ہیں، دیگر جو غیر ضروری ایکٹیویٹیز ہیں، گیدرنگز کو کینسل کر دیا گیا ہے۔ ظاہر ہے کہ اس کے پیچھے ایک بہت امپورٹنٹ ایک سیریس سچویشن ہے جو کہ ہم فیس کر بھی رہے ہیں اور فیس کرنے جا رہے ہیں۔ اس سچویشن کے اندر اس وقت میں بالخصوص امریکہ میں موجود اپنے جو ناظرین ہیں ان سے مخاطب ہوں، اور بالعموم وہ تمام کنٹریز، کچھ کنٹریز وہ ہیں کہ جو مثلاً اٹلی ہے، یونائٹڈ کنگڈم ہے، مثلاً چائنا ہے، وہ اس کے پیک فیز سے گزر رہے ہیں، اور چائنا جیسے کہ پیک فیز سے جو نیوز آ رہی ہے کہ وہ پیک فیز سے گزر چکا ہے، اور دے آر ایکچولی ناؤ گیٹنگ ریڈ۔ اب نیو نمبر جو ان کے پاس اتنے نہیں آ رہے ہیں، دیر از ناؤ نو انکریز ان نیٹ نمبر آف نیو کیسز، جبکہ امریکہ کی، پاکستان کی، انڈیا کی جو سچویشن ہے وہ ابھی ہم پیک فیز کی طرف جا رہے ہیں، وی ہیو جسٹ انیشیٹڈ، اور نمبرز کی طرف دیکھیں تو یعنی واقعی انسان کا دل جو ہے پریشان ہو جاتا ہے۔ کل میں نے آپ کو بتایا تھا ٹوٹل نمبر آف کیسز اکراس دا گلوب 304,000 سے زیادہ، یعنی 3 لاکھ سے زیادہ تعداد تھی، اور آج جو تعداد ہے گلوبلی یہ میں بات کر رہی ہوں 335، یعنی تقریباً 30,000 کیسز کا ایک دن میں کل 21 مارچ سے آج 22 مارچ کی بات کر رہی ہوں، ایک دن میں اکراس دا گلوب مور دین 30,000 کیسز کا اضافہ ہوا ہے۔ اور اگر ہم اس کی فیٹلٹی پہ یا جو اس کا ڈیتھ ریٹ ہے، نمبر آف ڈیتھس پہ اگر غور کریں، 21 مارچ کو کل آپ سے جب بات ہوئی تھی، ڈیتھ 13,000 نمبر ہمارے سامنے تھا، اور آج جو ڈیتھ کا نمبر ہے تقریباً مور دین 14,611 ٹو بی ایکوریٹ۔ دس ڈیزیز، دس کورونا وائرس جو illness یہ کاز کرتا ہے، اٹ ہیز claimed so far across the globe 14,611 deaths۔ اور اگر ہم ان پرٹیکولر امریکہ کے نمبرز کو دیکھیں تو امریکہ میں 32,356 جو ٹوٹل نمبر آف کیسز ہے۔ کل جو نمبر تھا آپ کے سامنے بتایا تھا 23,940، اس کو آپ کمپیئر کریں، کل کا 23,000، آج کا 32,000، یعنی تقریباً 10,000 کیسز ان ون ڈے۔ اور یہ ہم دیکھ رہے ہیں کہ شروع میں ایوری ڈے ہمیں لگتا تھا کہ 400، پہلے 2-3 کیسز، پھر 400، 500، پھر 500 پر ڈے، اور اب 10,000 پر ڈے، یعنی آپ دیکھیں کل سے آج تک 10,000 نئے کیسز جو ہیں اونلی ان امریکہ جو ہیں ڈائگنوز ہوئے ہیں۔ اور ڈیتھس اگر آپ دیکھیں صرف امریکہ میں کل نمبر آف فیٹلٹیز دیٹ دس ڈیزیز کلیمڈ واز 301، اور آج کا جو ہمیں نمبر نظر آ رہا ہے وہ 414، یعنی in one day we have lost more than 100 lives for this disease۔ اور نیو یارک کے اندر بے انتہا شدت پکڑ چکا ہے. تقریباً نمبر آف کیسز ان نیو یارک اونلی از 15,800, مور دین 15,800. کل جو تھے وہ 10,000 نمبر ہمارے پاس تھا, آج جو ہے وہ مور دین 15,000 ان نیو یارک اونلی. It has increased more than 5,000. There's 5,000 new cases in New York in just one day. That is pretty scary. اللہ تعالیٰ سے ہم دعا کرتے ہیں, پروردگار عالم سے ہم دعا کرتے ہیں, اور دنیا بھر میں اجتماعی دعائیں بھی ہو رہی ہیں سوشل میڈیا پہ, اس پر بھی ہم نے انشاءاللہ بات کرنی ہے کہ پروردگار عالم جلد از جلد اس وبا کا جو ہے وہ خاتمہ, ان اللہ علی کل شیء قدیر, وہ قدرت رکھتا ہے تمام اشیاء پر, تمام امور پر, تمام امور جو ہیں اس کے حکم کے منتظر ہوتے ہیں. ہم دعا کرتے ہیں, پروردگار عالم سے مدد مانگتے ہیں کہ پروردگار عالم اس وبا کا جلد از جلد خاتمہ کرے, کیونکہ واقعتاً اگر یہ جو ہم اسٹیٹسٹکس پر ہم غور کریں, دے آر ریئلی پریٹی اسکیری. اور یہ سچویشن تو ناظرین اس وقت ہے کہ جب ہمارے پاس لمیٹڈ ٹیسٹنگ کٹس اویلیبل ہیں. عموماً ایپیڈیمیولوجی میں یا اسٹیٹسٹکس میں جب بات کی جاتی ہے تو مثال دی جاتی ہے آئس برگ کی. آپ نے دیکھا ہوگا آئس برگ ہوتا ہے ایک بڑا سا, اور آئس برگ ہم دیکھتے ہیں, آئس برگ یعنی برف کا ایک بہت بڑا سا پہاڑ نما ایک تودا. جو یہ برف کا پہاڑ نما ایک تودا ہوتا ہے, اس کا زیادہ تر حصہ جو ہے وہ پانی کے اندر ہوتا ہے, بہت تھوڑا سا حصہ ایک نوک کی شکل میں پانی کے اوپر نظر آ رہا ہوتا ہے. تو اگر آنے والی کوئی شپس یا آنے والی کوئی جو جسے کہتے ہیں کہ کشتیاں ہیں, جو انہیں دیکھنے میں نظر آ رہا ہوتا ہے کہ ایک چھوٹا سا ایک ٹیلا ہے یا چھوٹی سی ایک چٹان ہے, what they fail to understand کہ below this little peak, below this little rock that is apparently seemingly a little rock, ایک چھوٹی سی ایک چٹان محسوس ہو رہی ہے, اس کے اندر ایک بہت بڑا پہاڑ نما ایک برف کا تودا موجود ہے. اور پھر اس پرسیپشن کے تحت جو اپیرنٹلی نظر آ رہا ہوتا ہے, بہت ساری شپس جو ہیں دے اگر ان سے ٹکرا جائیں تو ایک میجر ایکسیڈنٹ اور میجر ڈیزاسٹر ہوتا ہے, بیکاز دے آر ناٹ ٹرولی پرسیونگ دا گریوٹی آف دا سچویشن. ان کو دیکھنے میں نظر آ رہا ہے کہ ایک چھوٹی سی چٹان ہے, جبکہ وہ ان ریالٹی دا موسٹ آف اٹ از ہڈن انڈر دا واٹر, اور وہ نظر نہیں آ رہا ہوتا, اور چونکہ نظر نہیں آ رہا ہوتا پریپریشن اس حساب سے نہیں ہوتی, اینڈ اٹ از اے کمپلیٹ ڈیزاسٹر. یہی سچویشن اس وقت ہماری کورونا وائرس کے حوالے سے ہے کہ what we are seeing these numbers especially in the United States and even across the globe. ہم پاکستان میں بھی دیکھ رہے ہیں کہ اللہ تعالیٰ سب پر رحم کریں انشاءاللہ, اس وبا کا خاتمہ ہو اور لوگوں کو, ہم سب کو اللہ تعالیٰ توفیق دے. ہم سب کے لیے ایک لیسن ہے, لیکن بات جو ہم کہنا چاہ رہے ہیں وہ یہ کہ what we are seeing right now is only the tip of the iceberg. ہمیں اس وقت آئس برگ نہیں نظر آ کتنا بڑا نمبر آف actually infected people is actually present. What we are seeing is just the tip of the iceberg. So we have to perceive this situation. ہمیں فورسی کرنا ہے سچویشن کو, اس حساب سے ہمیں we have to be prepared and we have to be very very cautious. ہمیں یعنی ہر طرح کی جو پریکاشن جو ہمیں بتائی جا رہی ہیں انہیں میکسیمم پریسیشن کے ساتھ, میں کہوں گی میکسیمم پریسیشن کے ساتھ, کہ اگر ہمیں کہا جا رہا ہے 20 سیکنڈس کے لیے ہاتھ دھوئیں تو 20 سیکنڈس کے لیے صابن سے ہاتھ دھوئیں. میکسیمم پریسیشن کے ساتھ ہمیں ان احتیاطی تدابیر کو جو ہے وہ ایگزیکیوٹ کرنا ہے, وہ فالو کرنا ہے. اور اگر ہم نے آن اے پبلک لیول, اگر ہم نے ایٹ اے کمیونٹی لیول ان احتیاطی تدابیر کو فالو نہیں کیا ایز از, then it is going to be a big disaster. اللہ محفوظ رکھے. لیکن ہم سب, وہ جسے کہتے ہیں نا, وہ مثال بالکل صادق آتی ہے کہ ٹائنی گرینز آف سینڈ جو ہے وہ مل کے ایک بڑا سا ڈیزرٹ بناتے ہیں, یا لٹل ڈراپس آف رین میک دا مائٹی اوشن. تو جو جسے کہتے ہیں نا قطرہ قطرہ دریا میں شود, تو اس وقت وہی سچویشن ہے کہ every person in the community is acting like a single very very important vital entity that have to make their contribution, تاکہ جو ڈیزاسٹر ایکسپیکٹڈ ہے اس ڈیزاسٹر سے ہم اپنی پوری کمیونٹی کو, ویدر اٹس اے کمیونٹی, اے شیعہ کمیونٹی, مسلم کمیونٹی, ہیومینٹی ایز اے ہول, ہمارے لیے اس وقت کوئی تفریق نہیں ہے. انسانیت کا سوال ہے, انسانی زندگیوں کا سوال ہے, انسانی زندگی از ایٹ اسٹیک. سو وی ہیو ٹو take all these things into consideration. It is at this point ہم روز قیامت جواب دہ ہوں گے کہ ہم نے یہ، میں بہت سیریس اس کو سوچیے گا جو میں یہ بات کہنے جا رہی ہوں، روز قیامت ہم جواب دہ ہوں گے. ہم نے اپنے آپ کو بھی بچانا ہے اور ہماری ذرا سی بد احتیاطی سے وی آر آلسو پٹنگ ادر پیپل ان دا کمیونٹی ایٹ رسک. ہم اپنی بیوقوفی سے، اپنی بد احتیاطی سے، اپنی لاپرواہی سے اور اپنی جسے کہتے ہیں لیک آف انفارمیشن سے وی آر ناٹ اونلی ہرٹنگ اوور سیلوز اینڈ دا پیپل ان آر ہاؤس ہولڈ، وی آر آلسو ہرٹنگ ادر پیپل ان دا کمیونٹی ورلڈ وائڈ. جنرلی جہاں بھی ہم رہ رہے ہیں، اٹس لائک ہم دیکھ رہے ہیں کہ اٹس لائک اے فشن ریئیکشن. یہ شروع ہوا تھا چائنا میں، اور چائنا سے لے کر یہ پوری دنیا میں ایک سے دوسرے کو، پوری دنیا میں یہ پھیل گیا. فرام اٹ جسٹ اسٹارٹیڈ ان دا میٹ مارکیٹ آف چائنا کے ووہان سٹی کے اندر. ایک میٹ مارکیٹ کے اندر ایک انفیکشن کا اسٹارٹ ہوا، اور وہ انفیکشن جو ہے it has dangerously spread to the entire world. We are seeing it is a fission reaction very fast. اس کا جو پیس ہے بہت فاسٹ ہے. آپ دیکھیے کہ دسمبر سے لے کے اب تک how many lives it has claimed, how many people have been infected with it, how much the economy, world economy کتنا سفر کر رہی ہے. بچے جو آج اسکول نہیں جا رہے ہیں ان کی ایجوکیشن سفر ہو رہی ہے. ہمیں معلوم ہے کہ پاکستان میں بہت سارے، پاکستان میں، انڈیا میں، دیگر ممالک جو کہ ایسے ہیں کہ جہاں پہ پاورٹی جو ان کا لیول ہے وہ زیادہ ہے، وہاں پہ ہم دیکھتے ہیں کہ پیپل آر ڈیپینڈنٹ آن دیئر ڈیلی ویجز. ان کے پاس گورنمنٹ کی طرف سے اتنی سپورٹ نہیں ہے کہ وہ پاورٹی کو ہینڈل کر سکے، یا ایون ان لوگوں کو جو ڈیلی اپنے کھانے پینے کے لیے جو ہے وہ روزانہ کے لیے اپنی جاب کے لیے جو بھی وہ چھوٹا موٹا کام کرتا ہے اس کے لیے ڈیلی وہ گھر میں کھانا، اپنے باپ جو ہے یا ماں باہر جاتی ہے کام کرتی ہے اور گھر میں کھانے کا بندوبست ہوتا ہے بچوں کا، فیملی کے لیے. جب یہ لاک ڈاؤن ہو رہا ہے اور یہ ساری جو ایکٹیویٹیز ہیں یہ معطل ہو رہی ہیں، اور یہ اس کی وجہ سے کتنا بڑا امپیکٹ آپ سمجھیے کہ ایک طرف تو یہ انفیکشن، دوسری طرف یہ کہ یہ بھوک اور افلاس کے جو لوگ who are unable to cater to their daily needs because of lack of job opportunity, because they don't have anything to work, and they are not able to bring food, they are not able to bring food and bread to their family. یہ سب ہمیں ناظرین ہمیں سوچنا ہے. It's not just the infection, it's not just the death, it's not just the illness that we are concerned about, it's the world economy, it's the education of people, it's the people who are poverty stricken, it's so many things, and these are just few of the many problems that this disease has globally created. اور اس کے لیے جسے کہتے ہیں اللہ تعالیٰ نے اسے انسان کے ہاتھ میں ہی دیا ہے. اس کا جو ہے یہ کسی ایڈمنسٹریشن کو یا کسی ایک اینٹی کو ہم بلیم نہیں کر سکتے، بیکاز اٹس اے پبلک ہیلتھ ایشو. اس کے اندر ایچ اینڈ ایوری پرسن آف دا کمیونٹی از لائبل، از آنسریبل. اس لیے ہمیں بہت زیادہ ناظرین ہمیں اس حوالے سے وی ہیو ٹو بی ریئلی بیہیونگ لائک ویری ریسپانسبل citizens, really responsible people جو نہ صرف اپنا خیال کر رہے ہیں بلکہ اپنے اطراف میں انسانیت کا، انسانوں کا، دیگر انسان جو ہم سے متعلق ہیں یا جو ہم سے متعلق نہیں ہے بلکہ کمیونٹی سے تعلق رکھتے ہیں. گلوبلی انسانیت کے حوالے سے ہماری ذمہ داری کا ایک بہت بڑا سوال ہے. ناظرین آج ہمارے ساتھ ڈاکٹر زہرا سید، شی از گوئنگ ٹو بی ود اس ٹوڈے انشاءاللہ، اور اس میں ہم جو ہے ان سے ہم کچھ سوالات کریں گے. شی از ون آف دا کمیونٹی لیڈی ڈاکٹرز. الحمدللہ شی از سرونگ اگین لائک آئی سیڈ کہ ہمارے جو ڈاکٹرز ہیں دے آر ہماری فرنٹ لائن پہ ہیں اور وہ سرو کر رہے ہیں. سو وی آر گوئنگ ٹو کال ڈاکٹر زہرا، اور انشاءاللہ ان سے ہم بات کریں گے اور ان سے ہم کچھ سوالات پوچھیں گے. اور ناظرین آج یا کل انشاءاللہ ہم کوشش کریں گے ہم لائیو کالز بھی لیں انشاءاللہ. اٹ از اے پلیٹ فارم ٹو سپورٹ آور کمیونٹی. تو ہم چاہیں گے کہ آپ کے کچھ سوالات ہوں تو ان کو ہم اپروپریٹلی جو ہے وہ آنسر کر سکیں انشاءاللہ. ہم کال کرتے ہیں ڈاکٹر زہرا کو اینڈ لیٹس سی انشاءاللہ کہ if she can answer. السلام علیکم.
وعلیکم السلام. How are you?
Alhamdulillah. Dr. Zahra, welcome to our program today, and we are really thankful کہ آپ آج ہمارے ساتھ اس پروگرام میں شامل ہیں. We are really thankful and grateful, and we are also aware that mashallah you are a medical professional, آپ ڈاکٹر ہیں اور یہاں پہ آپ एज अ डॉक्टर भी सर्व कर रही हैं और एज अ कम्युनिटी मेंबर भी यू आर इन्वॉल्व इन सम एक्टिविटीज so that community level पर हम we could deal with this disease. Yes, जी डॉक्टर जहरा, आप कुछ कहना
Thank you
चाहें?
so much for having me. Thank you for asking me to come on. I think it's very important. As you said, I am a family physician, but more than that, I'm very Elabeth and Akhida, and our community is just held very close to my heart. I really truly worry about everybody in the community as much as I do for my own family. I think my biggest concern with our Houston community, we're very close to each other. We have a lot of akhida, where most of the families are living multiple families in one house. We have a lot of newer immigrants here in Houston compared to other cities. Most people have come after 1990 here, so they might have a little bit less opportunity. I know a lot of people in the community are without insurance. I have a big concern with a lot of community will not go to a clinic or a hospital to get treated because they might not be of legal status or something like that. So all these things worry me, and I really want that everybody has some education and know what they should be doing and where they can go for help if they need anything.
Thank you, Dr. Zahra, and we really appreciate your concerns and your willingness to help out, inshallah, in these tough times. Dr. Zahra, would you like to make a comment on, you just said that there are people in the community who have a lack of insurance. And as a primary care physician, as a PCP, what would you suggest to those people? And are there any community level activities? Are there any community doctors who are volunteering to help these patients out? Where can these people go?
So we have a COVID-19 team of professionals, and I think along with Maulana Farad Abbas, and we're trying to create some protocols for our community. I think Dr. Gokul has created a website where you can go for telemedicine visits. I individually have been doing a lot of visits. Texas Medical Board has relaxed the rules for physicians that, there's a lot of privacy rules and things like that that limited me from treating people over the phone in the past. So, I've already asked people, please try not to abuse, but if you have any questions, and especially if you need treatment and help, they can definitely come to me. There's lots of other physicians in the community, and we can try opening up those names for people to volunteer as much as possible. We want to keep everybody who is sick out of the hospital. A lot of the times, this is allergy season, flu season is not quite over. A lot of the times these questions can be easily managed on the phone. However, I have, personally seen a couple of patients, seen being in quotations. I've talked to a couple of patients on the phone, and we're able to direct them to testing. Testing is not easily available, but there is testing available for people who need it. If you don't have insurance, there is a cash pay. I can also direct you to certain physicians that will take cash pay. So it's it does require some money, but it's a kind of a smaller amount that you can manage without insurance. So definitely we can answer your questions as much as possible. We can try to direct you if we cannot handle it ourselves.
So what we are understanding from your conversation, Dr. Zahra, that Nazreen, कि अगर and especially this is specifically directed towards our Houston community, कि यहाँ पे alhamdulillah we have a team of doctors, and like she said that Texas Medical Board ने थोड़े से अपने rules को relax किया है, और पहले physicians were kind of restricted, like आप call करें and they would not be able to help you because there is a face-to-face encounter that is needed. But at this point of time, प्राइवेसी के हवाले से और रूल्स एंड रेगुलेशंस के हवाले से टेक्सास मेडिकल बोर्ड ने थोड़ी रिलैक्सेशन की है, and the physicians can actually help you and guide you over the phone. You don't have to have a face-to-face encounter with the physician to get tested, but the physician is going to just interview you. आपसे कुछ सवाल जवाब करेंगे, आप अपने symptoms उन्हें बताएंगे जो मसाइल आपको हो रहे हैं, और फिर they will determine whether you need the testing or not, one, and whether you are eligible for the testing. डॉक्टर ज़रा, currently बिल्कुल recent testing का क्या इस वक्त हमारे criteria, eligibility criteria? I know we have very limited testing kits. इस वक्त क्या testing criteria है?
So, Dr. Kaukab, everything is changing on a daily basis. What I'm telling you, what I'm telling you today is going to change by tomorrow.
Exactly.
But definitely the CDC criteria for testing is very, very limited. If you were going to get tested based on that criteria, you may or may not meet it, and most of the time I'm seeing that people are not meeting it. But for people who have a high level of suspicion, depending on where they've been, I can direct them to our private testing. Those tests are a little bit, that testing is less lenient. Those guidelines are less lenient. Less strict. And so that's more available, and we can get it done if we need to. But it's not an unlimited resource, meaning we still don't have a lot at this time, which can change all the time. So, anybody who's worried about a cold cannot go get a test. But if there is certain criteria, then we can direct you to get your testing done. So it's not as if it's not available.
ओके सो अगर जैसे पहले थोड़ा सा बहुत ज़्यादा स्ट्रिक्ट था नाज़रीन, व्हाट आई एम ट्राइंग टू अंडरस्टैंड इज पहले थोड़ा सा स्ट्रिक्ट था दैट ओनली पीपल हु हैव कफ एंड फीवर सिम्टम्स तो है, लेकिन उसके साथ दे हैव टू हैव अ ट्रैवल हिस्ट्री, दे हैव टू हैव अ कॉन्टैक्ट हिस्ट्री. फिर उसके बाद उन्होंने रिलैक्स किया. आई वाज यस्टरडे आई वाज लुकिंग एट एक्चुअली टुडे आल्सो क्लिक टू ह्यूस्टन का ह्यूस्टन की जो अपडेट्स थी, they mentioned कि पहले जो था they were limited to testing for यानी एज ग्रुप उन्होंने स्पेसिफाई किया था with the symptoms and with all this. अब people with chronic conditions under that cut off age they are also being tested, like Dr. Zahra said कि अभी इन्होंने थोड़ा सा they have relaxed a little bit based on the current situation we are in. And you can definitely seek help if you are residing within Houston area. Dr. Zahra and other doctors in the community, they can do a call, a telemedicine call, and they can kind of guide you over the phone. They can determine whether you need the testing, and they can also guide you and have you be tested. क्योंकि आप खुद से नहीं जा सकते हो कि any testing, you cannot just go and get tested. You have to have a physician. So can you make it clear, Dr. Zahra, you have to have a physician referral to get tested, right?
I think in certain areas you can drop in, but we prefer that you don't do that. First of all, if you feel that you need testing, you're going to be putting other people at risk by dropping in. Most of the testing is drive-through. We need to be aware that it's high risk to be face-to-face with somebody, especially not. So most testing is done drive-through. I know one physician in my community, she's doing testing where the patient can pick up the test kits, and they actually take the test themselves. I think she's been studying to make sure that this is is still a good sensitive test, and the patient is doing the test and then dropping the kit back off. So right now, everybody's trying as much as possible to keep everything risk-free. Most things are trying to be done telemedicine. Only severe cases are being referred to the ER and admission. So as much as possible for most of the community, we want to try to help answer people's questions on the phone and refer them over the phone so that we can keep people out of the hospital. Because another risk you're facing is that even if you are not infected, you can get infected by going into the hospital, since there's so many things there, so many cases there. So it's much better for everybody to social distance at home, and maybe that's something that we can talk about as well.
Yes, Dr. Zahra, can you talk about that a little bit? For social distancing, we are hearing that a lot. So, with respect to, let me ask you this question. For example, if somebody has a cough and some fever, and उनको नज़ला भी बह रहा है, और जो कोल्ड के नॉर्मल सिम्टम्स होते हैं, कॉमन कोल्ड के सिम्टम्स हो रहे हैं, along with low grade fever हो रहा है, 9900 fever हो रहा है. Should they go to the doctor? For example, if they are insured, they have a doctor, तो क्या उन्हें डॉक्टर के पास जाना चाहिए, or is it a good idea to first call the doctor first?
I think I want to say with a certain surety that most doctors are not seeing patients in the clinic as much as possible, especially for anything that looks like a respiratory illness. But if you are insured, you do have a doctor, it is better you call them and ask them what they want you to do. I can bet, every doctor is different. They run their practice differently, but I can most likely bet they would like to treat you over the phone, just to reduce risk at this time. Because we don't know exactly, sometimes, when before COVID-19 came to Houston, I heard more fever, cough, but what I'm seeing is sore throat. Some people are seeing diarrhea. So there's a lot of different changes, and maybe the virus itself is mutating. We don't know, but it's very different. So I think precaution is key here for everybody.
Yes, because when you're going to the clinic, you are also exposing yourself, for example, yourself to other patients, and you are being exposed yourself.
Exactly.
If खुदा न खास्ता you are infected, then you are, like I said, Nazreen, कि मैंने पहले भी mention किया था, it's not about our safety. We are talking here about the safety of the entire community. So if we, for example, खुदा न खास्ता have an infection, then we want to be careful that we are not giving that infection to the people around us. When we go out in the market, when we go to the doctor's clinic, wherever we go, we don't want to pass that infection on. Because like I said, कि ये जो बहुत तेजी के साथ ये फैल रहा है, और इसका बेहतरीन तरीका यही है कि हम खुद अपने आप को कंटेन करें टू लिमिट द स्प्रेड ऑफ दिस इन्फेक्शन। डॉक्टर ज़हरा, यू आर गोइंग टू कमेंट ऑन सोशल डिस्टेंसिंग। आप कुछ इस हवाले से बात करेंगी?
Yeah, so social distancing, I'm sure everybody's hearing a lot about this. This is sort of kind of the mechanism or the strategy that we're using to try to minimize the impact this is going to have. I'm sure everybody's seen a lot of things on social media, the news, etc. Being the country that we are not. It's very hard to quarantine people against their will, etc. We don't have an unlimited number of tests. So, they have decided that, and looking at this, that social distancing is the best way to basically minimize, one, the number of people who that can die from this, and then two, to minimize the burden on the healthcare system. There's just not that many beds for people who are going to require it, and there's just not that many ventilators for people who will need to go on a ventilator. There was some some people were saying that maybe the people who are high risk, they should stay at home and socially distance themselves, and those who are healthy and young should go out and go to work and go about their daily life, because it doesn't make sense for healthy young people to keep themselves in a closed house. And when they looked at that, they saw that if you do nothing, they projected that the amount of deaths that could happen is about equal to the size of the Los Angeles population. If you do nothing, what can happen is the amount of deaths equal to the size of that Los Angeles population.
That's
if
huge.
you do, that's a lot. So if you do, where healthy people go out and go to their work and do whatever they want to do, go to restaurants, go to gyms, and the high-risk people, the elderly, stay at home and protect themselves. If you do it that way, if you go by that strategy, then the population equal to Houston the deaths. The death that we're looking at is the population equal to Houston, which is still a lot.
Yes.
The only way to completely flatten the curve, what they're saying, not to burden the system, is for everybody to socially distance. So that includes healthy, young people. And the other thing, the study is showing that the most amount of transmission, meaning the most amount of spread, the most amount of people giving disease to each other, is a healthy young person. So the healthy young person is the one that's carrying the disease and going around and infecting most people. And if you're healthy and young, you don't have a lot of motivation to stay at home. You feel fine. You don't think anything is wrong. But and nothing is most likely going to be wrong for you. But you are a carrier, and you're carrying that between elderly risk people. We know that 20% are going to get a severe illness. So when I don't like to scare people, and I think a lot of people don't care about numbers, but I do want people to take it seriously. We have a big, mashallah, Shia population, and if you just apply this to us in Houston living, I think majority of us are high risk. Most of our community now is over 60. I think there is a lot of young people, but a lot of the community that first came to Houston now has aged. They're all over 60 now. Most of our men have heart disease. Even the women have high blood pressure. There's a lot of respiratory, asthma, smoking, a lot of that puts you at high risk. So these things kind of worry me when the younger, healthy people do not take it seriously, or they think that, we can, it's not a big deal if I meet with my other family. I mean, I think I would be helpful to give some kind of example of what social distancing should look like. If you are a family in your house, and I think that most families look like this, you are young, you are working, you have kids, and you have elderly parents living in your house. How should that look? What should you be doing? And I'll give you an example from my sister. This is her household. She's going out. Her husband is able to work from home, so that's great. But she still has to go to work. She has an essential job function. So she goes to work. She's very careful. They've made their rules stringent in their place of business. They're not allowing any sick people coming in. They're limiting adults to under 10 people. And then when she comes home, I've told her, and this is what we all are doing, she and my husband does this as well. He comes home, he changes outside, like in the garage or something like that, goes into the shower, washes off, so make sure he doesn't infect anybody else in the house. She's doing the same thing. She's making sure she's not infecting anybody else in the house, because she's got elderly people living in the house. Her kids have stopped going out to the daycare because the kids carry the disease, possibly, even though they might not get sick. They could be what's called a vector, or a way that the elderly Qur'an khasta could get sick. Her kids are not playing with my kids. we decided, and I think this point should also be taken, that every 3 days the caseload doubles or triples. So 3 weeks ago, 2 weeks ago, it was not as risky to be outside. But as time goes on, and we know already that community transmission is happening, what that means is there's cases in the community for people who have not traveled. They're getting it just randomly by being in the community. If that makes sense. If I don't make sense and if I'm being confusing, please stop me. So we know it's doubling and tripling as time goes on. So whereas 3 weeks ago it was not a big deal to go out, it was not as much, you could be less strict, but now as time is going on, the risk increases more. So it doesn't make sense for my kids and her kids to have a play date together, and this is a CDC recommendation as well. We know by looking at the studies in China that most of the transmission was happening inside the house. Until they started separating people from the house, their caseload did not go down. So what they did is and I don't want to go into detail with that as well, but until they started separating the people who are sick and quarantining them away from their own family, and until they started quarantining healthcare workers away from their own family, their caseload did not go down. So, at this point, it's not feasible to separate yourself from your family, especially if they're living with you. But we do have to be careful about the people who are going out once they come back in, what they're doing.
Exactly. That's a wonderful point and very, very important, very vital point, Dr. Zahra, that you mentioned. नाज़रीन, जैसा कि डॉक्टर ज़हरा ने बहुत क्लियरली बताया कि इस डिजीज़ को maybe 2 or 3 weeks ago it was not that risky, or maybe it was risky at that time too, but since we now know the numbers are exponentially increasing, and every day, like I was telling you about the caseload in the beginning of the program, कि इस वक्त बाहर जाना, it's not just somebody who has traveled, somebody who has close contact, people are just randomly getting the illness. Yesterday I had to go to a grocery store, Sam's Club. I went there and I saw this lady, और वहाँ पे they are not allowing a lot of people at one point. So वहाँ पे उन्होंने I saw this lady जहाँ पे line बनी हुई थी. She said, now this is how she's actually practicing social distancing, which I didn't see being practiced a lot, because even in the lines people were not like 6 feet apart. They were kind of some places, for example, if अगर आप shelves में कुछ ढूंढ रहे हैं तो they are close together. But this lady, when she saw a bunch of people there, she said, I'm not going to walk through all these people. She went through पूरा घूम के वो दूसरी side से जहाँ पे थोड़ा खाली था वहाँ से हो गई, because she was actually, and this is how it is supposed to be. जो हमें 6 feet का distance बताया गया है, 2 meters or 6 feet, we have to stay away from any person, not just the infected person, from any person. If we have to, एक तो ये कि हम कोशिश करें, if we don't have to go out, it's not necessary, if it is not essential, we don't go out. और अगर हमें जाना पड़ रहा है, then we are practicing, we make sure that we are practicing social distancing. This is one, for example, when we are going to a market or a grocery store. जो डॉक्टर ज़हरा ने दूसरी बात कही, within the family, I think it's a great practice that their family implemented between her and her sister, कि ये डिसाइड किया कि जनाब ठीक है, 2 हफ्ते तक या 1 महीने तक हमारे बच्चे आपस में नहीं खेलेंगे, बच्चों को दादी के या नानी के पास आने नहीं देना है, या ये कि कोई जो बाहर से आने वाला है, somebody has to go for some essential work outside of house for their job and stuff, when they come back they make sure they are disinfected before they come in contact with other people.
Yeah.
So all these things are very, very important. Sometimes within a family, Dr. Zahra, and I would like to for you to make a comment also on that. Okay, within the families in our culture, you were talking something about our community being at higher risk. हमारे अंदर जो cultural values हैं, हमारे अंदर जो ये सारी values हैं, मसलन हाथ मिलाना, गले मिलना, और घर के अंदर जो होता है ना, एक रख रखाव होता है कि जनाब माँ बाप के साथ आप कुछ बात, यानी in our cultural perspective, we would maybe take social distancing as something rude. Somebody is trying to be rude, or I think we have to put all those things, all those values aside at this time. Dr. Zahra, would you like to make a comment on that?
I mean, if you asked me this 3-4 weeks ago, I would say maybe it's unnecessary. Oh my God, the way what I'm seeing and what I'm reading, nothing is more important than life. Nothing is more important than saving your sister or brother, meaning sister and brother in Islam, sister and brother in Velayat. Nothing is more important than that, to save their lives and keep them out of harm's way. Sometimes somebody will take it the wrong way, but unfortunately, hopefully they will understand as time goes on. I know that 3 weeks ago, I myself did not realize the importance of this, because it was kind of withheld from us what was happening. And once we started seeing some of these cases in the hospital, in the community, and I started reading what's happening in these case studies, I have a lot of contact from San Francisco and Los Angeles, because I went to school there. When I started hearing from my colleagues what was happening, I got really scared. And the first thing I started thinking of what's going to happen in our community, because most people don't realize, they're not compliant. It's very hard to try to get them to take their treatment and this and that. People with just diabetes, they will do what they want to do. People do what they want to do, Allah malaka type of situation. And that's okay, But with this, your decision impacts everybody else. If you don't follow the what we're trying to recommend, then you could possibly hurt somebody else in the community, because the only strategy we have right now is for everybody staying away from each other. We can do dua, hopefully, inshallah, something completely changes, something happens, some kind of major treatment, will come forth. But as of right now, the best thing we have is social distancing. And we can also talk about a lot of, people saying that there is treatment available. So if you want, I can touch on that as well, as what the reality is in that.
If you can, Dr. Zahra, that would be a great information.
So, I know there's a tweet, the president has been tweeting that we found the treatment, etc. I want to warn, yes, there are some medications in very, very small trials, not very good trials, showing that it might have worked. There's not really good benefit. So meaning, no, we don't have major treatments available. Those treatments are for, as of right now, severe cases in the hospital. Outpatient cases are not going to be treated with any of, I think the drugs that were mentioned were, hydroxychloroquine, which is known as Plaquenil. It's usually used in lupus and rheumatoid arthritis. We bases tend to know it as a malaria drug. And to clarify on that, FDA has not approved it yet. They have approved it for compassionate use. So what that means is that we're not going to, a doctor is not going to get their license is not going to get affected if they prescribe it, because but is it available for somebody on the outpatient side to use? No, it's really not. So the best thing to do is prevention. At this point, the best thing to do is prevention. Severe cases that end up in the ICU might be able to use it. Severe cases in the ER might be able to use it. There's also another HIV drug called remdesivir, which is being given in the ICU. But again, you have to apply to use it. It's very, very hard to get through to be able to use that drug. So the best thing to do for everybody as a whole is prevention.
Exactly, that is very important thing. नाज़रीन, ये जो मुसलसल हमें सोशल मीडिया में ख़ास तौर से इट्स काइंड ऑफ मिस इन्फॉर्मेशन, हम जिसे कहते हैं कि एक मिराज में जस्ट एक हमें वो दिखाया जा रहा है कि नहीं, इसका ट्रीटमेंट जो है वो आ गया, ऐसा ट्रीटमेंट, ठीक है ट्रीटमेंट, बट इट्स स्टिल इन द ट्रायल फेज. वी डोंट नो वेदर, दो इसके बातें हमें जहन में रखनी है. एक तो ये कि ट्रीटमेंट, यस इट इज इन द ट्रायल फेज, वी डोंट नो वेदर इट इज इफेक्टिव, रियली इफेक्टिव और नॉट. एक बात तो ये. दूसरी बात ये कि जो मुझे डॉक्टर ज़हरा की बात से समझ में आया कि इट इज अनदर थिंग टू गेट अप्रूव्ड टू बी ट्रीटेड फॉर दैट. So even if you are in the hospital, if somebody lands in the hospital with this infection, and they have to, हमें तो इस वक्त ये भी देखना है कि even testing के लिए भी eligibility देखी जा रही है. तो ये treatment के लिए ये जो दोनों दवाओं के नाम दिए डॉक्टर ज़हरा ने, इसके लिए इट्स वेरी क्रूशल टू बी एक्चुअली अप्रूव्ड के डॉक्टर जो है एक्चुअली इट्स अ होल प्रोसीजर के वेदर द इन्फेक्शियस डिजीज part of the treatment or management team, they approve of it and the hospital approves of it, FDA approves of it. There's multiple levels के क्या क्या उनकी eligibility. So even we cannot be thinking कि अगर खुदा न खास्ता हुआ तो we know now there's a treatment available. No, the treatment is in trial phase and we don't know whether somebody will be eligible to get the treatment or not. और मैं आपको personal experience share कर रही हूँ. In UK, one of my colleagues, his father, unfortunately, he got sick with this disease and he is hospitalized. This person, he's a doctor and his father is hospitalized. He's elderly. he's in critical condition, but at this point in that particular hospital he is not approved to receive hydroxychloroquine. He's not getting that. He's only on
Oh,
supportive
really?
treatment. Yeah, so he's not getting that. So that is my very personal, one-to-one experience that I'm sharing. So we cannot sit and relax. Okay, treatment is available. We have to, like Dr. Zahra is again and again reinforcing, prevention at this point of time. Prevention is one thing that we can all do, that is difficult to do, especially हमारी जो cultural जो values हैं, even out of cultural context, within the family it is very difficult to isolate. दूसरी
Yeah.
बात जो बहुत इंपॉर्टेंट डॉक्टर जहरा ने बोली कि जो इस मर्ज के अंदर जो कैरियर्स हैं, दे आर those young healthy adults जो they are less likely to get seriously ill, but they are carrying the infection around and they are very likely to pass this infection to the person who can go very critical. तो छोटे बच्चे या ये एज ग्रुप जो 20-30 years का एज ग्रुप है, they are less likely to be critically ill, but they're very, very likely to pass that. They will stay asymptomatic, and that is very dangerous situation. Asymptomatic का मतलब ये है कि a person has the infection. Dr. Zahra, would you like to tell our viewers asymptomatic infection क्या है and how dangerous it is? And that would be, we will conclude on that, inshallah.
I mean, asymptomatic infection, I don't know if I would call it an asymptomatic. Asymptomatic carrier is a better word, meaning that somebody can sometimes carry the infection, carry the disease, and they're shedding the virus, meaning they're shedding the infection when they're coughing or touching things, and they don't show any symptoms. They don't have a cough, they don't have sore throat, they don't have fever, they don't have anything. So they think they're healthy and they're going back and forth between people, seeing people, doing things. And while they're doing that, they're infecting people as they go. I know a lot of, and it's sometimes the best thing that we have, a way to do it is they're checking, temperatures. I've heard at certain hospitals to make sure that before you come inside. But we know that when you have these asymptomatic carriers, that you're losing that when you're trying to sort of hurdle who the people are going to be allowed to come inside a job or a hospital or a certain area, you're missing all the people who actually don't have any symptoms. So those are the people who are sort of breaking through and able to infect people that are at high risk. As far as the danger to the person themselves, they're kind of not in any danger. And that's why it's hard to recommend anything for them, because that person has to do something that doesn't benefit themselves in a way. But it does benefit if the community as a whole, and for any close, near and dear family members that they have, that they should not be, if they could be careful, they could socially distance, be smart about where they go, only limit their exposure to necessary functioning. That would really help save a lot of people who could potentially get sick. And if you have a little bit of time, I can tell you, I know our community really does like to look for alternative medicine and supplements. What things you can take, or what is, nothing is good evidence, but what people are recommending as a general, vitamins and things like that could maybe help you stay healthy.
Yes, please, Dr. Zahra.
I can say that vitamin D is being recommended because it helps your inflammation. We're seeing that the people who get seriously ill tend to go overdrive with their inflammation, so vitamin D is something good to take. Zinc also, a lot of physicians are recommending zinc and vitamin C as well. Okay. So those three things, and then in general, good sleep practice and healthy eating, etc.
Exactly. Thank you so much, Dr. Zahra, and inshallah, we hope because this is an ongoing program, we are going to have it every day, inshallah. Because goal is to create maximum awareness within the community and flatten the curve, inshallah, and do our maximum, inshallah. So we will request, inshallah, later on also, whenever you have time, please give us some time, inshallah, so our entire community can benefit from your knowledge and information, inshallah.
Inshallah. Thank you so much for having me.
Really appreciate, Dr. Zahra. Thank you so much. Jazakallah. Take care. Fi amanallah. Hafiz. नाज़रीन, ये थी डॉक्टर ज़हरा सैयद from Sugarland, Texas. She is a primary care physician and she gave some very valuable information to us today. Alhamdulillah, and there is a lot more that needs to be talked. Program का वक्त जो है हमारा is very limited. But थोड़ी सी बातें जो डॉक्टर ज़हरा ने हमें बताई, I would like to kind of recap on that. एक चीज़ जो मैं एक add on, which I will probably repeat in some other program also. न्यूयॉर्क का अगर आप जो उनका स्टेट वेबसाइट देखेंगे तो न्यूयॉर्क के गवर्नर ने there's something called Matilda's laws that he has implemented for 70 plus जो elderly हैं, and that we can implement here also. जहाँ जहाँ ये हमारा प्रोग्राम पहुँच रहा है, it's not for Houston, it's not only for Texas, it's not only for New York, it's not only for US, it's for everywhere. Whoever is listening to this program, it's for everyone. A general measure that New York के गवर्नर ने has recommended for elderly who are most as at risk. तो उन्होंने जो बताया कि for elderly to remain indoors at all times. यानी elderly should not even go out. अगर कोई 70 plus है, then they should try to ask somebody to arrange for their groceries, medicines, and whatever their daily needs are. But they should ideally they should not be going out at all. So they remain number one. I'm just going over Matilda's. You can also Google search it. So don't remain indoors. Don't go outside, but you can go outside. Again, ये क्वेश्चन एक होता है कि क्या हम बाहर वॉक करने के लिए जा सकते हैं? So if you're living like in a suburban area, if your area is not very crowded और जैसे खाली पार्क वगैरह में कोई इतने लोग नहीं है, तो you can definitely go out for a solitary stroll. आप वॉक करने के लिए बाहर जा सकते हैं अकेले. But definitely if you're living in, for example, in an apartment complex जहाँ पे के बहुत सारे बच्चे और लोग और ये सब वहाँ पे आपको बाहर नजर आएंगे, so just it's better to stay indoors. फिर so remain indoors. You can go outside for a solitary exercise. You have to screen visitors for a temperature. For example, if you're going to एक तो ये कि you don't have visitors at this point of time, don't have any visitors coming to see you. And this is specifically for 70 plus population. Agar if you do have visitors come in, screen them for temperature. If they have temperature or not. So whoever visitor is coming to see you, they should not have a temperature. So you screen वही आपसे मिल सकता है जिसको कि बुखार ना हो. फिर mask. Elderly 70 plus, they should wear masks. They should stay 6 feet away. जो social distancing है, specifically elderly should definitely practice the social distancing because they are very much at very high risk. फिर उसके अलावा लास्ट जो कि शायद ये सारे जगह पे ये एप्लीकेबल नहीं हो, लेकिन अगर हम बैनुल अक़वामी एतबार से बात करें, फॉर एग्जांपल पाकिस्तान, इंडिया एंड डिफरेंट अदर कंट्रीज इन द वर्ल्ड, पब्लिक ट्रांसपोर्टेशन. नाज़रीन, पब्लिक ट्रांसपोर्टेशन, इफ यू डोंट नीड टू गो टू सम प्लेस, do not use public transportation for something that is not essential, something that is not needed at that point of time. So avoid public transportation. These are points for a 70 plus, but I would say कि ये हम generally we should avoid public transportation. और स्पेशली हम पाकिस्तान में, आई एम फ्रॉम पाकिस्तान, आई सीन कि पब्लिक ट्रांसपोर्टेशन जो है वो ओवर क्राउडेड होती हैं. खैर पाकिस्तान में भी एटलीस्ट सिंध के अंदर वी नो कि एक जो है लॉकडाउन सिचुएशन वहाँ पे अब हो गई है, एंड दे आर टेकिंग देयर बेस्ट मेजर्स टू कंट्रोल द सिचुएशन. बट इट इज़ समथिंग दैट इज़ गवर्नमेंट तो इम्पोज करेगी कुछ चीज़ें, लेकिन देयर आर अ लॉट ऑफ थिंग्स which we have to impose ourselves within our household. If we have an elderly person, उसको हमें बहुत ही एहतियात से ट्रीट करना है. उससे अगर फॉर एग्जांपल इवन इफ वी हैव अ कॉमन कोल्ड, खुदा खासा वी आर नॉट डायग्नोज्ड विद एनीथिंग, स्टिल वी हैव टू मेंटेन सोशल डिस्टेंस, वी हैव टू स्टे अवे फ्रॉम दैट पर्सन, बिकॉज हम लोग या यंगर पीपल 20 to 30 or even younger, they can you know deal with this virus in a much better way. लेकिन जो एल्डरली हैं या फॉर एग्जांपल डायबिटीज है, बाय द वे इस पर मैं कल आपको बताऊंगी, अभी तो प्रोग्राम का वक्त खत्म हो रहा है, बट ये एक वेबसाइट HoustonMuslim.org के नाम से एक वेबसाइट है जिस पर आप जाकर यू कैन लुक फॉर टेली मेडिसिन कंसल्ट ऑल्सो, और वहाँ पे आपको एक लिंक मिलेगा जहाँ पे दैट इज अ रिस्क कैलकुलेटर. तो अगर आपका 2% से ज़्यादा रिस्क है तो यू हैव टू बी रियली केयरफुल. If your risk is less than 2%, still you are at risk, still, but you are among those people जिनको ये virus probably will not affect, but it's it's unpredictable. You never know कि कौन कितना sick हो सकता है. Recently, social media पे we saw a 21-year-old guy who was very वो coach था I believe soccer का, and he expired because of the complication of COVID-19. So at any age, anybody can be at very high risk. लेकिन generally speaking, ये risk calculators, if they tell you okay, if you are less than 2%, then you need to worry more about people around you. Still you need to worry about other people around you, but if it's more than 2%, تو آپ کو خود بھی اپنے آپ کو بہت زیادہ محفوظ اور حفاظت میں رکھنا ہے, کوارنٹین کرنا ہے, پراپر سوشل ڈسٹینسنگ اینڈ آل دوز تھنگس which we will be talking about in our future programs انشاءاللہ. اینڈ اس وقت آپ سے اجازت چاہیں گے. آئی ہوپ کہ ڈاکٹر زہرا کی جو گفتگو تھی دیٹ واز ویری ہیلپ فل فار آل آف اس. وی لرنڈ a lot of things and that was kind of a reinforcement for all the information that we already have. انشاءاللہ اللہ تعالیٰ ہم سب کو توفیق دے کہ ہم بیٹر ہیلتھ ہیبٹس اسپیشلی ان دس چیلنجنگ سچویشن وی آر ایبل ٹو پریکٹس گڈ ایکسلنٹ not just good, excellent health habits inshallah, practice whatever is being taught to prevent the spread of this infection. اور اللہ تعالیٰ جو بھی مریض ہیں انہیں صحت تندرستی انشاءاللہ عطا فرمائے. تمام دنیا سے انشاءاللہ جلد از جلد اس وبا کا خاتمہ ہو. ہم سب کو انشاءاللہ اپنی دعاؤں میں یاد رکھیے گا. ہمیں سب کو ایک دوسرے کی دعاؤں کی بے حد ضرورت ہے. اپنا بہت خیال رکھیے گا اور اس کے ساتھ ہی ہم آپ سے اجازت چاہیں گے. والسلام علیکم ورحمۃ اللہ وبرکاتہ.